everybody. I'm Gwen van der Bijl, and today I'm interviewing Dr. Ulco Schuurmans. Dr. Schuurmans worked in the public health sector, providing information on health and working with preventive electronic healthcare. In addition, he is a well-known editor of various video, multimedia, and ICT magazines, TV maker, and author of several books on the use of audiovisual and digital media. Hello, Dr. Schuurmans.
Hello. That's me.
Yes, hello. You have sent out some very interesting podcasts on the topic of the day, the coronavirus. I would like to ask you some questions which help to sort out the facts from the fiction about this virus. So here we go. So what is the coronavirus?
The coronavirus, officially named SARS-CoV-2, has a crown of spikes around the virus body. So it is called the coronavirus because it looks like a crown. You could look at the coronavirus as an USB stick for the computer. The plastic housing is the jacket for the virus. The USB connector is a spike that helps to attach the virus to the human cells. Inside the USB stick is the virus program, a genetic RNA code. That code instructs human cells to do two things: multiply the virus, spread it as much as possible.
Thanks. Well, how dangerous is this virus?
Yeah, if you ask how dangerous a virus is, you have to answer two questions. How contagious is it? Dus how well it will spread. The second question, how severe and deadly is it? Now, the first, maybe the publication in the media suggests that SARS-CoV-2 is both very contagious and deadly. Very contagious, that's true, but deadly is how you look at the statistic figures. In the case of the coronavirus, most people have few problems. Only a low percentage has more serious health problems and die. But the greater the spread of the virus in the population, the more critical patients and deaths will come. The law of the big numbers. The second concern is the available health facilities. If you don't have health facilities, coronavirus can be very deadly because people can not do anything about it. That's known from the Spanish flu in 1918. People could do nothing and they died as flies.
Wow, yes. Thanks. So how does it differ from other flu viruses?
The SARS-CoV-2 virus resembles in its behavior an influenza virus and ook partly the SARS virus. There are few differences. It's a new virus. Not everything is known about the virus. It spreads very rapidly, mostly with little or only severe cold symptoms. There are no vaccines available. That's the second problem. Probably some antiviral medicine and antibodies will work, but that's partly experimental at the moment.
Thanks. We've been constantly bombarded with numbers of deaths. Should we be overly worried?
Worried is the number of deaths, but the problem is how many deaths are reasonable. If I look to an epidemic, let me see, in 2018, there were 10,000 deaths. We don't forget it. And there were about 900,000 people sick in the Netherlands. Dus how severe is it at the moment? Yeah, if you look at the figures, 900 deaths at the moment and 1,200 people in the IC. Yeah, what is now to be worried? How much are those numbers? Yeah, and we can blame the media for the so-called infodemic. That's a tsunami of news, mostly correct, but also a substantial amount of fake news. The problems with this way of spreading news is that it becomes itself a disrupting virus. That is because it is very difficult to recognize the really important, reliable information. If you see every day new numbers, live blogs, news items, editorials, tweets, and animated statistics, the people can think that it must be severe. Measures change by the day, and several countries do their own things. Fake news can be very dangerous. Some advices are really toxic for people or distort the public opinion.
I have to agree. What are the symptoms of the coronavirus infection and how is it spread?
That's the problem. The symptoms of the SARS-CoV-2 virus are very much like a common cold or flu. Coughing, sneezing, fever, pain in the limbs, a sore throat, a malaise. The pneumonia, the so-called acute respiratory distress syndrome, only occurs by the elderly and weak. Spreading happens by flying fluid droplets with a virus within. These droplets can directly penetrate after sneezing or left behind on smooth surfaces. The virus penetrates the humans' airways, mouth or eyes.
Okay. What is the best method of defense against the spreading of such a virus?
Yeah, there are two methods. The first method is prevention. Dus the best method in this is to prevent contact with infectious virus droplets. Dus keep distance, the so-called social distancing. And yeah, one say 1.5 to 2 meters will be sufficient. Do not sneeze in the air. It's an explosion of virus droplets. Cough in the elbows or use a paper handkerchief. Disinfect surfaces. The next ones are group immunity and vaccination.
What is group immunity?
The virus had to spread, otherwise it cannot develop in an epidemic or pandemic state. If one patient infects 2 or 3 other people, it will spread like a forest fire. If one virus carrier infects less than one other person, the spread of the virus will extinguish. As the population, 60% of the people are immune, they do not become ill and do also not spread the virus. The virus contamination will extinguish. That's called the group immunity. By vaccination, the immunity can rise to 95% and more. The virus cannot spread anymore.
Okay, that's interesting.
That is good. Yes,
it was very good. Have governments taken enough precautions?
The precautions and measures of governments are complex. They are partly based on experience from the past, new insights, advice from experts and political interest. There are several problems in the case of SARS-CoV-2. The first, the virus is new. 50% is known, but the public want 100% results. There is too little collaboration between countries. Several governments do their own thing. There is an important difference between draconic measures and disproportionate ones. Draconic means severe, but it has to be done and the measures is well substantiated. In case of disproportionate, the measure does more damage than the problem causes itself. Panic, political pressure and populace are bad counselors.
So there are good and reasonable measures, but also bad and insane ones, in your opinion?
Yes, and that depends how you see it.
Definitely. So what influence...
A good example is, must schools close or not?
Yes.
One expert says do not close the schools because children can also be contaminated outside the schools, dus where you should close the schools. And others say yes, but the schools are brewing is as a center of contagious infections and that kind of thing. Dus we have to close the schools. There's a different opinion.
Yes, that's true.
And if you are a political man, you have to decide something. And what think your voters on the back? Eh? They say if you do nothing, they will claim that the politician is an idiot. And if you do it well, it's also not good.
That's right. And then there's the poor business people who are not so happy with all this. That's right. So what influence do you think the media coverage of the coronavirus outbreak has had on the society as a whole?
As I did say before, the media can do a lot of good, but also can cause a lot of damage in the case of misinformation, infodemics and fake news. Good journalism contains two aspects. Good quality of the content itself. True, it's checked, use the right sources and explain it on the understanding level of the receivers. Because if people don't understand the message, they can do anything with it. Yes. But you have also to dose the news wisely. If you have a tsunami of news, people are drowned in the news and cannot understand what's happening.
Right.
Beware of the severe negative effects by panicking. The whole world can come tumbling down.
I agree. Do you have any other advice you would like to give our viewers?
Do not let them get to you. Don't panic, but use common sense. Check the facts and figures. Use the so-called 5 V's. First, we, what is it? what is it about? Second V, then is it correct to take action or just not to take action? The third V, who has to do it? Fourth V, with what resources, with what facilities you have to do it? The fifth V, when to do it, the right time. Take care of the weekends. Do not let things like disproportionate measures and world disruptions happen. Raise your voice and make yourself heard. Beware of the future, it can happen again.
Right.
Okay.
Is there anything else you would like to add?
Yes, we can learn lessons from the past. It's described before. The Spanish flu is naturally well known, but we had also earlier griep epidemics. In 2016 there was one in Holland, in 2018 there was in Holland. And they made a lot of casualties. And is it so different at the moment? The most different problem is, of course, the IC capacity. We don't have enough beds for the patients. But yeah, if you want to see, when is it enough? In 2016, there was a survey of the National Security Coordinator that said we don't have enough EC places for people if we had a pandemic. Yes, and now you see we didn't learn from it, and we have a problem.
Right. So the solution isn't really to close down the country, but to handle the bed problem.
Yeah. The best solution is people are focused on the ICs places in hospitals. But we don't want the people on the IC because it is very disturbing for the people itself. They become lung damage, they become post-traumatic stress syndrome for the EC. We have to interrupt the virus before it becomes a lung disease. We have to develop medicine, we have to develop vaccines, we have to develop antibodies to kill the virus before it becomes severe in the pneumonia. And then we do something what's much better than all the people on the ICs.
Okay.